So I want to first of all say hello to everyone and thank you to Dr. McCullough to have me kind of host and moderate this uh, the gift you give yourself Zoom and discussion about this incredible book. And with that, to all of you, since I don't know probably any of you, except I see Susan tagged in there, and I'm looking here of any of my other folks I don't know, so I want to say hello. And of course, I wish I can be, named one of the America's top plastic surgeons. Congratulations, you got that, Dr. McCullough. But anyway, first of all, I want to say, everyone, if you are relaxing, grab a cup of coffee, cup of tea, or if you have a little cocktail, I'm going to have a little sip of Bordeaux, so I'm excited about that. And what I just want to do is take about 2 minutes before we start. I start asking Dr. McCullough these few questions. And I want to just mention about how I know this young man. So I'm also a facial plastic surgeon. You might have seen me on the TV show. It's called Botched, where I do, with another plastic surgeon, I fix a lot of surgeries that have gone wrong. But we discuss the pros, the cons. We meet a lot of patients that have gone too far. And it's kind of the antithesis of this book, The Gift You Give Yourself, because some of these patients have went completely the other way. And I met Dr. McCullough, and if you read my forward in the book, it talks about this as a resident doing head and neck surgery. And I remember going out to Birmingham originally. Remember that when you had that, the big institute there? And very intimidating doctor, very intimidating man. His height, his presence, his reputation, and what an incredible surgeon and a pioneer at that time. But I didn't really know him personally because I was a student. And then as we fast forward of me being now a facial plastic surgeon and being in practice for maybe 21 years or so, this man and his lovely wife have become incredible friends. But what's interesting, when I went through my own hard times, I went through a divorce. It's very difficult at that time. And now, thank God, I'm married again and I have a beautiful 3-month-old baby. It's interesting how many times at our different medical meetings that he would sit me down and say, Paul, sit down. How are you? What's going on with your life? And this, and really go through with me. And this is, again, somebody doesn't really need to, but he took it on himself to make sure that I was doing okay. And this was a start over 12, 13 years ago, or maybe 15 years, when I really started to know him really well, of an incredible friendship. So I'm honored to be here. So with that being said, and with this incredible book that Dr. McCullough put together, you titled the book, Dr. McCullough, I might call him Galen, by the way, so it's just me doing it, The Gift You Give Yourself. Now, can you explain to the audience, really what this gift is and how someone can give it to themselves?
Well, first of all, Paul, I want to thank you very much for taking your time, because I know how busy you are, not only with your practice, but with a television show. And I really appreciate you taking this evening to visit with me and our group of friends that are on this call. I did. It took me probably, maybe 2 weeks to decide the title of this book. And I came up with the name, The Gift You Give Yourself. And then when we started putting this program together, and the question came, what is the gift that a person gives themselves? It's taken me another 3 days to just condense that into a few words. And these are the words that I came up with. And I think the gift that we give ourselves, first of all, is we have to make a decision to take charge of our life. And then secondly, we have to commit to become the best possible version of ourselves that we can be. And then thirdly, we have to develop the attributes and the abilities that we already have to their maximum potential. And if we do those 3 things, I believe that we've given ourselves one of the greatest gifts that we can in this life. Are we still on?
Oh yeah, we can hear you.
Oh, okay. All right. Well, that's really the short answer to that. And then um, if we, I think the other mistake that we sometimes make is we tend to focus on the things that we are not really that good at. And I believe we have that upside down. I think if we spend more time focusing on the things that we do well, we'll actually end up doing them better. And then if we associate with the people that can help us become an even better person, physically, mentally, socially, and spiritually, then we've given ourselves an opportunity to live a life, a blessed life, and a life that we can leave behind more than we found when we got here.
Beautifully said. You know, for a lot of the folks, and I assume a lot of these are your patients or your friends that are on right now. And for those that may not be aware, how should a prospective patient search look about finding the right surgeon for them?
Well, I remind everybody that the subtitle of this book is The Surgical and Other Choices That Enhance Your Appearance, Confidence, and Health. And so in order to do that, you might need more than just a surgeon. I think it really is important that each one of us tend to put together a team of professionals that we assemble. And that might include professionals who are not necessarily physicians or surgeons, life coaches, dentists, fitness instructors, nutritionists, estheticians, and wardrobe consultants. And then if we do that, we can surround ourselves with people, good people who know things that we don't know, learn from them, and then take all of this and put it into a life plan. When Susan and I were in Florence, she was exhibiting in the Florence Biennale. We were very fortunate to get to know a woman from Scotland who called herself an international change navigator. It was the first time that I had ever heard of that title, but she would go into companies and figure out what was wrong with those companies and then make recommendations of ways that they could improve things. She said something to me during that Biennale that I've never forgotten it. I've included in most of my books ever since. And that is that every person must find their own place in the universe, the one place where your star can shine more brightly than the surrounding stars. And I'm convinced that each one of us can find that place if we do the things that I mentioned earlier, surround ourselves with good people, and then just commit to doing the best that we can do every day and keep our head down and don't get distracted by the small things.
Beautiful. I never heard of that term. I'm sure none of us heard that term before. Thank you for that. And that's extremely enlightening. That it's a team, almost from the way you make it put together, as you mentioned, surgical and other choices. In chapter 37 of the book, you talk about how physicians and surgeons can help their patients develop a complete scenario of mind, body, and spirit enhancement prescription. Now, how do you encourage your patients to engage in health lifestyle habits, such as balanced nutrition, weight management, physical fitness, and psychological well-being? And why is that important to the overall well-being?
I had what I would call a very eclectic training program. I mean, everything from being medical student and resident to being the first medical director of nursing homes in the state of Alabama. So I saw aging at both ends. And I developed what I would like to call a holistic approach to caring for my patients. And in the nearly 50 years that I've been what I call a life-enhancing physician and surgeon, I've come to notice that the people who do the things that are required to look their best tend to find better health, even if finding better health might not have been their primary objective. And along the way that we, in becoming our best self, I think we also need to accept the fact that looks matter, and first impressions matter. I once came across a quote by Aristotle, who said that a pleasing appearance is more important than any letter of introduction, or what he really meant was a resume or a letter of reference. And so what that means is that when a person walks into a room, he or she automatically is going to present a first impression. You have the ability to either build upon that impression, or you might have to overcome it if it's negative. And so I think we need to pay attention to all the little things that many people might not necessarily think are important. For example, our posture, the way we stand, the way we sit, the way we carry ourselves, something that I like to call countenance. We have to be aware of our weight because if we are not overweight and we look fit, we're going to look like we have endurance, and we'll be around to help the person that is interviewing us do what they want us to do. And then I think that our clothes, the way we wear our clothes, and the way we wear our hair and the accessories. And I don't think that the things that we wear necessarily have to be expensive, but I do think they need to fit well, and they do need to be coordinated. And those are the things that have a tendency to give a good first impression upon which we can build. And I remember oftentimes I think about a song that was recorded and sung by the great Whitney Houston, who said, "Learning to love yourself is the greatest love of all." And I'm not too sure, but what that isn't the greatest gift of them all too. If we learn to love ourselves, we give ourselves the ability to become the very best person that we can be. I think if we do that, we feel better about ourselves. We tend to have more confidence. We think greater thoughts. We dream greater dreams. And as a result, we tend to see more of our dreams come true.
Beautifully said. Matter of fact, when I hear that, talk about appearance, I want you all to excuse my hair. I just got out of the operating room, and it's a little long. But in California right now, everything is closed, so I can't get a haircut. So excuse me. All right. Now, this is a two-part question, Dr. McCollough. Now, can you share with our lovely audience some of the non-surgical ways that a person can enhance their appearance? And then, of course, the other side of that, what are some of the other ways to slow the aging process, or really prolong the need so that they don't need to go see you surgically?
I mentioned some of those in the previous question, and that is our posture, the way we stand, the way we walk, our weight, our clothing. The other thing that I think is important is a smile. I don't believe we really realize how important a smile is. It speaks volumes. As a matter of fact, you can go anywhere in the world and you might not speak the language of the people there, but if you smile, you usually get a communication, you get a smile back. So you've connected with those people. And I think that it's important that we keep a happy face and a happy outlook on life and let other people see that. And I believe that we're attracted more to people who look like they feel good and feel good about themselves and are enjoying life. So I do think that that's important. And then I think also one of the most overlooked things, I believe, in terms of putting our best self forward is character. And in every opportunity, wherever we are, whatever we do, whomever we're with, if we exemplify an impeccable character, I think that we're attracted to other people and other people are attracted to us. And then at the very bottom of the list is plastic surgery. The plastic surgery, of course, is both cosmetic and reconstructive. The cosmetic is the part that's done strictly to improve one's appearance. The reconstructive part is usually done to try to restore the body to a state that existed prior to an injury, an accident, or perhaps a birth defect. Also, well-conceived plastic surgery can bring the body features into balance, and balance is beauty, or in the case of men, handsomeness. And I think all things in moderation is the key to this. The plastic surgery that is performed needs to be natural and have a rejuvenated appearance and not appear to be overdone. And Paul, your television show makes this point better than any source in recent history, because you deal with people that have had many surgeries and some of them disasters, and you really are faced with having to go in and reconstruct and rebuild people's, not only their faces and their bodies, but rebuilding people's lives. And I'm not sure that many people out there understand that how the great opportunity that we who do this type of work have to improve a person's outlook on life and improve their lives in every way possible. We don't necessarily extend the length of their lives, but I think we do improve the quality of their lives. The second part of your question addresses ways that we can delay the aging process. And I believe that there are many ways that we can, in fact, delay the aging process and in some respects reverse the aging process. Earlier, I mentioned weight management. There's a condition called Syndrome X, which means it's a combination of obesity, high blood pressure, and type 2 diabetes, which usually follows obesity. There's no question but what patients who have these conditions shorten their lifespan. We're seeing that especially during this COVID pandemic, because the so-called comorbidities of obesity, high blood pressure, and type 2 diabetes are those are the patients who have very high risks, and many of them do not pull through the COVID virus infections like other folks do. There are ways that we can slow down the aging process. No question about that. Smart or focused exercise tones and renews our muscles, including our heart muscle, and it keeps our circulation system open to vital organs. And circulation is vital, of course, to the brain function. And that will have a tendency to slow down or reduce the incidence of dementia. Excess use of nicotine, alcohol, sun exposure, tanning beds, all of those things tend to age your skin and age your body as well. And then the final thing that I want to stress is learning how to handle stress. That, as much as anything, in my opinion, is what ages us. And all you have to do is look at the presidents. When the presidents go into office, and then you look at them 4 years later, they've aged much more than 4 years. Many of them look like they've aged 10 or 12 years in 4 years and 20 years in 8 years if they're reelected. And all of these factors are life habits, and they affect the aging process. So the book is designed to point these factors out, and then also to tell people what they can do to take control of their life and what they can do themselves to make themselves look better, feel better, and live longer.
You know, that last point you made, it was interesting. 2 weeks ago, someone sent me photos of Barack Obama after his first 4 years, aged dramatically, and after his second 4 years.
Yep.
And he went from looking really young to he aged. I mean, just the color of his hair. And you would think that, well, how could stress change the color of your hair? But I will tell you, it sure does. And he really got old looking. And thank you for that. I mean, as a matter of fact, you and I talked about that before, because I lived an unhealthier lifestyle with lack of exercise, and especially, you know, when I was going through my own personal life stresses and not eating the best way, and not handling stress. And I agree with you, stress is the worst part of them all. And with exercising, eating better, and trying to handle stress, and I got to tell you, that's the hardest of all, trying to handle stress more appropriately. And that's something that we will continue to work on for all the days of our lives. But it is so important. So thank you for that. Thank you for enlightening us. Now, besides us being facial, plastic, and nasal surgeons, a lot of our patients will come to us and say, you know what, doctor, let's talk a little bit about body or breast augmentation and body work. And basically, since we don't do that, how do you advise your patients on this? The best next steps?
Paul, I believe there's a reason that you and I don't do body surgery. The old adage, jack of all trades, master of none, I think applies to plastic surgery. And I believe you did as well, from our conversations that we had when you were a resident, chose very early that we wanted to become a facial and nasal plastic surgeon, and that we focused all of our training and we focused all of our energies and efforts on that. Now, turn that around, and there are other individuals who decided that they wanted to do the other aspects of plastic surgery. And I think the greatest gift that a professional can give to himself or herself is to recognize that they cannot do everything, and at least they can't do everything well. So many fields, many surgeons choose fields of plastic surgery that complies with their interests and abilities. They focus on that, and they become excellent breast and body surgeons. And I'm very fortunate in my practice, and you are in your practice as well, to have a doctor, a surgeon. Dr. Brentley Taylor works with me, who does beautiful breast and body surgery. And so I refer all of those patients to him. And fortunately, I and you have those doctors within our practice, and so the patient can still stay there in our practice and have full body surgeries. We do combinations. I will be doing a facial surgery at the same time Dr. Taylor is doing a tummy tuck or a breast surgery, and that cuts down on the anesthesia time, it cuts down on the cost, and it's one recovery period as well. So we try to do those things that are convenient for the patient as well as cost effective. So what we do is we recognize what our limitations are. We find colleagues who are experts at doing those other procedures, and then we refer our patients to them. And we don't lose those patients. They continue to come back to us for the things that we do.
Got it. I 100% agree with you. Now, you and I have seen a lot of prospective patients that we don't recommend appearance enhancing surgery. So if you could, can you share some examples of when you don't recommend cosmetic surgery?
You know, I think that's one of the hardest things that we do. The surgery, frankly, and I think you would agree with this, the surgery is the easiest part of my day. I love it when I get in the operating room and when I can get my scrubs on and focus just on the operation and be there in the operating room, and nobody can get at you when you're in surgery. He's in surgery, he's not available, right? And so I really enjoyed that part of my day. The hardest part of my day is dealing with new patients and screening patients and trying to determine if the patient has realistic expectations. And that is the basic principle that I use when I determine whether or not I'm going to accept a patient. If I realize that the patient does not have realistic expectations, even if the surgery that we perform turns out to be really good surgery, they're not going to be satisfied with it. And I'd rather not operate on somebody than to operate on somebody and have them dissatisfied. Another group of patients that I think we have to perhaps either not operate on or be very careful about are patients that are in poor health. And it's part of our process that we do a very extensive medical screening on our patients. We probably do a more extensive screening than 95% of the surgeons that do plastic surgery in the country. Not only do we do extensive blood work, but we require a medical clearance from their personal physician, and we review all of that. And if there are any questions, then we require that they see specialists, whether it's a cardiologist, a pulmonologist, or whatever, before we agree to operate. And right now, with the COVID thing, of course, all of our patients are tested for COVID before we do the surgery. Another group of people that we have to be careful about are those individuals with psychological conditions, particularly one called body dysmorphia. These are individuals that will never be satisfied with how they look, and they become somewhat plastic surgery junkies. And not to be disrespectful, but most everybody on this call will probably remember Michael Jackson. You know, I thought Michael Jackson got a great result with his first couple of surgeries that he did, but obviously he was never satisfied, and he continued to go back, and surgeons continued to do operations on him. And after a while, Michael became a creation. He didn't look like an African-American. He didn't look like a Caucasian. He didn't look like a male. He didn't look like a female. He became a creation. And there are others, sad situations that we've all seen photographs and maybe TV clips on those individuals. And even as much as we try to screen patients, every once in a while, somebody fools us. Some of them are very clever and they slip by. And I've got a couple of patients of my own that I didn't realize had body dysmorphia until after I had operated on them a couple of times. And it is very, very difficult to manage them after that fact. Many of them require or should have psychological counseling and refuse to do it. So it's a very sad state. I think that one of the things that I try to teach the doctors who come and train with me is that we have a tremendous responsibility. Our responsibility is to be a doctor first, to do no harm, and then a surgeon second, and then to do what we can do, the best that we can do for our patients, and to do the right operation at the right time in every patient's life. And you know, you've heard me say this in some of the presentations that I've made. Um, no two facelifts are the same, nor should they be, because the same face is a different face at different ages. And you might not do exactly the same procedure that you do, say, on a 75-year-old person that you do on a 45-year-old person who wanted a little facial tuck, and vice versa. So you have to make sure you tailor the operation to the conditions for the patient. And if surgery is not indicated, I think it's our responsibility to tell the patient that we don't think they need the surgery. And what I generally do is I say, I don't think you're ready for that right now. Let's take some photographs, come back in a year or so, we'll evaluate that. And but rather than just say, I'm not going to operate on you, I think you can work with them, and many of them you can get over the hump, so to speak. And they become very loyal and very devoted patients when they realize that you're not trying to sign them up for everything that you do.
Fantastic. Galen, what age should a person begin to consider cosmetic surgery? And is there such a thing as too young?
Well, let's take those questions in reverse order. Some procedures are indicated in infancy or shortly thereafter. For example, a baby with a cleft lip or cleft palate. That surgery is indicated very early in life. And although it's reconstructive surgery, it definitely has a cosmetic component, because these children look normal. They look like other people rather than having the terrible defect in their lips and in their palate. So there is some plastic surgery that's indicated in infancy. And then I think you move up the ladder a little bit, children with large ears that protrude. See, the ear is 90% its adult size by the time a child reaches the age of 6. And so we recommend that if a patient or a child has large ears and needs some setback, that operation be performed before they start to school, somewhere around 6 or 7 years of age. And we move up the ladder a little bit to the teenage years. I think you would agree that the most common operation we do in teenagers is rhinoplasty, nasal plastic surgery. And in many of those patients who have a problem, maybe an insufficient chin, we do chin augmentation in those patients as well in the teenage years. And then we go to the young adults, say the 20s to the 30s or so. And they're people who have fat deposits. Maybe it's a family trait. They have fat deposits that won't go away with weight loss, and particularly under the chin. We see this quite often in young people who have a fullness under their chin. Make a little tiny incision and do some liposuction, remove that fat, and not have to do any skin tightening. And we can do that in very young adults. And then, of course, once they get to be 20s and 30s, we start seeing patients that participated in sports when they were early or younger, have broken noses, have difficulty breathing, crooked noses, and many of them will come in and have those corrected, and scars, playing and different things, bicycles. Maybe they had scars and had some work done when they were children, but they can have additional scar revision. And then we move up into the 40s and 50s, what I call the early stage of rejuvenation surgery. And again, in that age, one of the first things we begin to see are surgery around the eyelids, heavy upper eyelids, little bulges, bags under the lids, brows begin to settle a little bit, and liposuction also. Once you move up into the 50s, I categorize 50s to the 80s in pretty much the same group, because that's where we do face and neck lifting, eyelid surgery, and skin resurfacing. This is where skin resurfacing, I think, becomes one of the best things that we can do. Combinations of peels, chemical peels, dermabrasions, and lasers. All three of these are effective, and it really depends upon the skill set of your surgeon, and let them tell you about what they do most, whether it's laser or chemical peel or dermabrasion or combination. And a skilled surgeon will pick the right one of those for you based upon your problem. And I'll digress here just a little bit. When it comes to skin resurfacing, there are a couple of things that I feel very strongly about. Number one is it really doesn't matter whether you use a peel, a dermabrasion, or a laser. It's the depth of the original injury that determines the outcome of the surgery. And then I remind my patients of the 2-week rule. If it doesn't take 2 weeks to heal, you're generally not going to get long-term results. And so, yes, you have the downtime, but in the long run, the downtime is well worth it. The bottom line, I think, is this, that there are more factors in the aging process than our chronological age. That's how many years we've lived. Our biological age, I think, is more important. That's how old our bodies actually are. And the best example I can give of this is if you've been to a class reunion, you're all the same age. Within months, you're all the same age, but look around the room and you will see that some people look 20 years older and some people look 20 years younger, even those that haven't had little nips and tucks. But it's our family history, our genetics and our lifestyle have to do with the aging process. So there are many, many factors there. And in the book, I try to address all of those factors and then give people some ideas and some tricks and secrets that they can do to manage the aging process and feel better, look better longer.
Well, thank you for that. We have about 5 more minutes. And so this next question, I'm sure you can answer, but it's an interesting question. You know, in 2020, the Zoom boom came up, and this was a hot news topic. And you're saying, what is a Zoom boom to all of you listening? Basically, the number of surgeries seemed to spike as a result of COVID because everyone being home and using Zoom or other types of social media devices. Now, what do you think is the cause of this boom? And then what specific procedures that you noticed are particularly popular with this uptick in surgeries?
Okay, I think I can cover that in a short period of time. Number one is the reason for the boom are virtual group interactions, just like this one. People are seeing themselves on a screen and realizing that they didn't realize they had as much drooping skin in their neck or along their jaw lines or their droopy eyelids, and seeing themselves on a monitor screen or an iPad. Working from home gives people time to recover from surgery that they might not have if they had to go to the office every day. There are fewer social gatherings, and so people don't need to be back out into their normal activities quite as often. And then wearing masks. Wearing a mask can help camouflage some of the swelling and bruising that occurs with surgery. Now, the procedures that we see are the ones that you would imagine, the ones of the face, eyelids, facelift, neck lifting, rhinoplasty, skin resurfacing, all of those things. And I think another factor that hasn't really been addressed in a lot of topics or articles that I've seen is that people are staying at home more, eating more, gaining more weight. And so I believe people are then now starting to look a little bit more at having tummy tucks and body liposuction and breast reductions. And so I think there's also been a boom in body procedures because of all of this COVID thing that we're facing as well.
Well, that was a fantastic answer. I mean, we've all experienced that, especially like when we're sitting here looking at ourselves, especially if we're looking down like I am. First thing you start looking at is the neck, and then you look at your eyes, you look at I mean, all of us have done that. So we have, we have 2 minutes. Is there anything else that I missed that you'd like to mention before we go to a question and answer session, Dr. McCollough?
Well, maybe a couple of things. Let me just address 2-3 things that I mentioned in the book again. I talk about too good to be true products and procedures. The public needs to be very careful about new things that come out that are hype. And I go by the 7-year rule. I think it takes about 7 years to really determine if a new procedure is better, safer, and more effective than the procedures that we've had out there. Now, that's not always true, but I am neither the first nor the last to jump on the bandwagon of new procedures. I think we need to sit tight on that a little bit, and patients need to be careful. And I include this. I know I get a little bit political here, but I include the COVID vaccine right now as part of that. I'm a little bit concerned and skeptical about a vaccine that was developed very quickly and didn't go through the normal clinical trials that many of those go through. So the too good to be true products and procedures are something that I would just alert people to be careful about, investigate, ask people you know, particularly medical colleagues that you know, before you go and have a new procedure where a doctor might have bought a piece of equipment and gone to a weekend meeting and peeled 3 or 4 tomatoes, and he's peeling faces or lasering faces on Monday. And Paul, you and I both know that. I've often said that the most dangerous time for the public is 1 week following a plastic surgery meeting, where people go and present new techniques, and somebody's never done it will go home and try it on Monday. And we have to be a little bit careful about that.
That's great. And those are so valid and so true. So Amy, we'd like to go back to you to start for our remaining, 20 minutes? Questions and answers.
All right, thank you, Dr. Nassif and Dr. McCollough. For everybody that's in the event right now, if you could just go over to the chat feature, you can ask any questions that you like for Dr. McCollough and Dr. Nassif. I will get us started with a question of my own for Dr. Nassif.
Ooh.
Yes, starting with you. So Dr. Nassif, in your endorsement of The Gift You Give Yourself, you said anyone who is thinking of having a procedure done should read this book. What do you think this book contains that other books on personal enhancement do not?
Well, as I mentioned, in one of my thoughts is I've been a patient of plastic and reconstructive surgery, both. And when I read this book, before making a comment about it, some of the stuff, since I'm a doctor and I already do this, I knew, but some of the content I really didn't even think about. And it was very enlightening to me. And I said to myself, darn it, why didn't he come out with this book about 2 years ago, which is before I had, for example, a procedure. So I thought in regards, it opened up another way of thinking about vitality, youth, feeling great, but especially just about us and about, again, as mentioned, about the way we live, the way we think, stress, all the other things that could encompass longevity, I think is the best way to say it. And so on these aspects, I thought that, this book really it was a gift to me to read it. Obviously, if I have anything else done, which I'm sure I'll need something down the line, because I do like to feel good. I do like to exercise, eat better now. I got to stay young. I have a young family and I want to be healthy, but at the same point, I want to look good. And so I think this book is absolutely amazing. And so that's what I meant. And that's what I've learned about the book.
Great. Absolutely. Great answer. We have a question here. Let's see. Okay. What are the leading professions of women and men seeking plastic surgery? And Dr. McCollough, you can start if you like.
I understand. I got a note here that our connection might not be very good, and I apologize for that. But the profession, it really is all over the board. You would think that it's really for the rich and famous are the most common people who have plastic surgery, and certainly they're among that group. High profile individuals that are photographed often or on television seen every day, or models, and that's politicians, that sort of thing. But we find in our practice that people who budget their money for vacations are the same individuals who budget for plastic surgery. Teachers, we see a lot of people in the education field who come and have surgery done because they have realized that they relate better to the students. If the so-called generation gap, the more narrow the generation gap, the better the relationship between the teacher and the student. And if the student sees someone that looks like that they're older, they think, well, they don't really realize our problems. They can't identify with their problems. We're seeing an increase in men. When I first started in this field, only about 5% of our patients were men. And now that's up to at least a third. At least a third of the patients that we operate on, and I'm talking now about eyelid surgery, I'm talking about cosmetic surgery, age reducing surgery, rejuvenation surgery. And of course, men tend to have more nose surgery older in life because of breathing problems. And that's something that's oftentimes not understood. You can correct a deviated septum and improve the breathing, and it may improve sleep apnea in some cases. Another condition that people don't realize are headaches. Every month, we see 2 or 3 patients that have a diagnosis of migraine headaches all their lives, and nobody ever considered a deviated septum, meaning one that's pressing against the sidewall of the nose as a cause of the headache. We correct the deviated septum at the same time that we're doing a cosmetic operation on the nose. And those patients' headaches either go away totally or become less frequent and less severe. And so it really is all across the board in terms of the professions of people that are having the surgery.
Right. Yeah. And Dr. Nassif, would you say that in your experience, it's about the same?
Oh, absolutely.
Yeah.
And the first thing I thought about was teachers, when that question was asked, just like Dr. McCollough said. So I absolutely agree with everything. There's nothing else to add to what he said. It was perfectly stated. But I do have a funny question. I got to ask this, though. And I kept wanting to ask this question from when I got this book. I got to show everyone this. Dr. McCollough, you're running here. How the heck do you keep a smile like that when you're running like this? I mean, look at this guy. This is Mr. Football Player, University of Alabama.
I wish. That is not me. That's a stock photograph that I got that was a man and woman who was active and looked like they were healthy and they were dressed well, even though they were working out. And so I thought this is the perfect photograph to put on the cover of this book because it tells a story of men and women who want to look good and exercise and eat well and dress well and all of those things. I wish I looked that good, Paul.
I know. I'm saying I know it wasn't you, but I'm saying, this guy here, he's got that big smile on his face. Boy, I wish when I run, I'm in pain when I'm running.
Well, let me tell you this. I did my last running when I hung up my football uniform. I had done all the running I ever wanted to do. So if you see me running, somebody's chasing me.
Chasing you. All right. Okay. Sorry, Amy. Go ahead. I had to ask that.
Not at all. That was fun to hear. And this next question is actually for both of you. So what trends do you anticipate being the most popular in 2021 with weight gain within the pandemic? And Dr. McCollough, would you like to go first?
You know what? You're going to have to ask that question again. I was distracted a little bit while you were asking the question. I'm sorry.
Not at all. Yes. So what trends do you anticipate being most popular in 2021 with weight gain within the pandemic?
With weight gain?
Yes.
What trends?
Yes.
I think we're going to see more depression. I think we're going to see more psychological problems with patients, with people in general. Being locked in and not being able to interact with individuals. Football, Paul mentioned football a little while ago, and there was a big question at the beginning of the season as to whether or not there was going to be football. And I kept telling everybody that I think America needed football. We needed something other to think about and talk about rather than this pandemic. And so we've had the election. People are talking about that too, but it's hard to get away from the sequestration and the quarantining when you look at the politics of it. I really don't know other than psychological, because we have seen a lot of reports that the incidence of depression and suicides has been up considerably during this pandemic. You agree with that, Paul?
Unfortunately, I 100% agree. I mean, we were just talking, I have 3 teenage boys, and they seem to be doing okay. But their loss of socialization, going to school, hanging out with the kids, playing on these damn video games and all that type of stuff. And then really, as we talk about really what is the long-term effect going to be? And we may not know for a long time. But the thing is, it's happened to everybody. In addition, I agree with you. 2020 has been a hard year. I mean, you know, just dealing with the election and politics, Black Lives Matter, this horrible virus, and then what's going out throughout the world. I mean, this has been something that I think from the positive, now let me switch and go converse for a second. I think from the positive standpoint, that is all the negative, and I'm sure there's more negative that we can find in it. But one thing that it actually did for me from a positive side, I'm one of these workaholic guys. You know, I have surgery center I need to run. I have a medical practice I have to do. I have a TV show. I got a skincare line, and then I'm on, you know, like shopping networks and TV and doing all that for skincare. So I work all the time. One thing it did for me for that 2-month period or month and a half period of staying home, it completely changed the way I think about materialistic things, about working, and basically focus more on the family. And that is the one positive thing it's done. It's changed my life in regards to, I want to be home more. I want to be around my brand new baby and around my kids more. And I'm actually downsizing my life completely. So from the positive aspect, I know this is not at all the answer to that cosmetic question, but to answer that quickly, you're right. People have not had the opportunity to exercise. And what we hope to do is not cosmetic surgery procedures. We hope everyone gets back to, now you can order stuff back from the gym, because even all weightlifting and exercises were gone. Now that's coming back online. You get more treadmills and go outside, do more hikes and walk. I hope that everyone can actually get back in shape naturally and by eating better, rather than getting, you know, a machine to help get rid of fat or surgery.
Let me pick up on that as well. On the psychological aspect of things, one of my professors, my mentor, whose name was Jack Anderson, used to call what we do, Paul, psychological surgery. And he used to say that unless you really enjoy dealing with the psychological aspects of humanity, you don't need to be in the field of plastic surgery or cosmetic surgery. And I agree with that. I like this field because I have more time to spend with my patients and I get to know them. And after a while, many of them start opening up and talking to me about their family problems, their business problems. And almost every day when I go to work and come here in this clinic, I'm a psychologist as much as I am a surgeon for those few hours. And frankly, I love it. I really enjoy that because I think you can make a difference in people's lives in many ways, not just with a knife and scissors, but in being a doctor and listening to them. And after a while, when they develop their confidence in you, they'll open up and tell you things they might not tell other people. So I think the psychological thing, I'm seeing a little bit more of that during this COVID pandemic than I did before this came along.
Mm-hmm. Yep.
That's right. So Amy, we have about 7 more minutes. Do we have more questions?
I actually do have another question here. And this one is for both of you as well. How do you address the PT who comes to you for nasal surgery and is expecting insurance to cover the procedure?
I'm going to let Dr. McCollough handle that.
I wanted you to start with that one.
You want me to? I'll be more than happy to.
Why don't you start? I'll add.
At our level, you know, we don't, and I know this sounds horrible, but I'm going to say it. Well, sorry for that noise. My wife is opening a box over there. It's okay. We heard it here. It sounded like something else, though. And you got to bring the baby over for everyone to say hi to if she's awake. Paulina. Okay, well, bring her over if you can, baby. So I'm going to say it. I'm just going to come out and say it and be the bad guy here. You get what you pay for. That's why if you watch the show Botched, patients will go to these places that have, you know, discounted plastic surgery, and oftentimes that is so true. That adage, you get what you pay for, is correct, especially when it comes to operating on the face. you know, at our level of our career, when someone comes to our office and says, well, I want insurance to pay for our surgery, it's pretty rare that we're going to accept that because, you know, we've been working on this field for many years. Dr. McCollough, a lot more than me. And usually if there's a functional part of a rhinoplasty, it's a small part of the surgery. The rest of it is cosmetic. And the insurance, it's illegal to bill the insurance for that functional part of the case. So there's always basically the cosmetic portion for the surgeon fee, the operating room, and the anesthesia. And then on the functional side, which is the insurance side per se, the anesthesiologist, the surgery center can deal with it directly. But from my standpoint, what I do is I'll help the patient bill, but they still, in general, have to pay the surgeon fee or whatever it is. And I'm sorry, I had to come out and say it, but now I'm sure Dr. McCollough will say it a lot softer than I said it.
Well, I don't know about that. I resigned from all insurance companies about 17 years ago, and it was the happiest day of my life because what happened, it got worse. It's worse today than it was then. You'll bill, and I've never billed an insurance company for what was a cosmetic part of the operation, but I have billed them for the functional part, and the patient pays for the cosmetic part. But trying to get the insurance companies to pay for functional surgery, legitimate surgery, is getting more and more difficult. And we found that the first thing they did was an automatic denial, a form letter. And we would spend a lot of staff time going back and billing, and they'd wear you down, and 6 months or a year later, they'd offer you 20 or 30% of what the bill was. And it just really got very frustrating. And so I resigned from all insurance companies, including Medicare, Medicaid, Blue Cross, Blue Shield. And so when patients come to me, they understand that they're going to pay the full bill. Now, the fact that we have our own operating room and anesthesia team here, we're able to do the surgery for less money than we would if they had to go to the hospital and do it. So I'm very cost conscious, and I try to keep the cost within reason for patients. But I don't get into the insurance thing. When somebody comes in, like Paul said, and they won't be insurance to pay for their surgery, at that point, I refer them to someone else. And some of that is my partner. My partner's a young plastic surgeon just getting started. And he's been in practice 3 years now. And so he's still doing some insurance stuff. So we do have an alternative. But for me, I totally agree with Dr. Nassif. It is difficult surgery, and there's a lot that goes into it, and we just ask the patient to pay, and they pay in advance. It's one of the few things in medicine that you pay in advance. Not necessarily so. We've had some experience recently with the cataract surgery in the family, and the cataract doctors are beginning to charge in advance for some of the parts of their operation as well. So I think we're going to see more and more of that as we get socialized medicine or national health care.
Very good points. And it was hard to keep a straight face with that baby looking so adorable over there.
This is Dr. Paulina. I want her to become a great golfer and a good doctor.
She'll be the queen.
Golf with me.
She's the queen of your kingdom right now, I'm sure, Paul.
My little baby. And she's wearing a little Christmas outfit. Little Santa Claus.
Oh, that is just... Oh, okay. Well, with that, I actually think that we are about out of time. So on behalf of Brown Books Publishing, I would like to thank Dr. Paul Nassif and Dr. Galen McCollough for joining us here tonight. It has been an intriguing conversation, and I hope it has inspired many of our viewers to go and buy Dr. McCollough's new book, The Gift You Give Yourself. If you go to the registration link that we had sent everyone, then you actually have plenty of buying options directly from that link available to you. To everyone watching, we appreciate your time, we appreciate you, and we wish you a very great rest of the week. Thank you for tuning in.
Amy, I would like to say thank you to you and to Millie and the entire Brown Books group for putting this together. It's been very enjoyable, and it truly is an honor to have this conversation, this public conversation with a good friend of mine and a man who I respect tremendously, Paul Nassif. And Paul, I want to thank you for taking your busy, out of your busy schedule time to be on this with us. It's very, very enlightening and greatly appreciated.
Well, I want to say, first of all, thank you. You know, obviously, since my time is limited and this is family time, if you didn't mean that much to me, you and your beautiful wife, and how incredible this book was, obviously, you know, I would not be doing this. But because of the content of the book and you as an individual, a wonderful person, a great doctor, it's my pleasure.
Thank you very much.
Thank you
And
both.
Amy, nice meeting you from Brown Books. Amy, we should do a book sometime. And to all of you out there, I want to thank you guys, and obviously, please be safe during the rest of this darn experience we're going through.
Absolutely. Absolutely. Yes, thank you both again so very much. And thank you to our viewers. Take care and have a good week.
Bye-bye.
Good night, everybody.